that. So, Miss McShane, would you like to share with our audience your story and what you experienced?
Sure, I'd be happy to. Thanks so much for having me, and thanks so much for having this event and just doing so much for our city and leaders and communities. So, my name's Alison McShane. I'm a proud Detroiter. I'm pretty much born and raised here, but we recently we bought a home in on the north end of Detroit a few years ago, and I got pregnant, and a uh, it was a wonderful birth story, all of that. But this home that we bought had a lot of work that needed to be done, and we were slowly doing it. Just getting the roof was a huge step, but and we were living in the home while we were renovating, which we'll come to find out was not a great idea. But so 2 years ago, we were getting ready to undergo some more renovations inside the home after doing the roof. And it was a historic home. It was built in 1890, so there was a lot to be done. And my son, who was 9 months old at the time, was happy and healthy, super energetic, and starting to explore the home. And so mom's instinct was a little concerned because there were parts of our home that we were closed off, but um, he was crawling around. So I asked the pediatrician to test him for lead in his blood, and she said, she didn't discourage me, but it was kind of like we normally only test at a year, and this is only for children who are Medicaid recipients, and that there's not really a need. And I was like, well, can you just do it? And so she performed the in-office pinprick test on his finger, and we went about our way with his exam and his shots. And as we were leaving, she pulled me back to off to the side and said, your instincts were correct. He's got elevated lead levels. His levels at a 10, and we need you to go to the hospital and confirm everything through a venous draw. So I went to the hospital, and getting blood from a 9-month-old is terrible. It's awful enough, but I was obviously very concerned. And so the venous draw revealed that he was at an 8, and so I immediately removed him from our house because I was like, we don't know exactly where this problem originated from. It could have been a maternal exposure from me. It could have been, dust, like we're about to find out. So I removed him from the home right away, and we lived somewhere else and had the whole home tested. And it turned out that it was, dust pretty much everywhere, coming from the windows, on the sills, and just tiny microscopic dust. And he wasn't, crawling around eating paint chips, which is kind of what I thought that lead exposure, lead poisoning is from, is people literally eating paint chips. So I didn't think that the dust or the things that we were doing around the home were actually hazardous. I just kind of had a feeling that it wasn't a good idea, but I obviously learned a lot through this process. So we had the whole house tested, found it pretty much everywhere. The renovations and the abatement, the cost of all of this was just too much for our family to undergo. It added probably another $50,000 to abate it, which it just didn't seem, we just couldn't do it. So we actually bought another home nearby that was smaller, that had, was done. And we just kind of abandoned our dream of having this awesome big Victorian house downtown. and bought a smaller home. In this house, I had it tested right away when we moved in, and there were lead on the walls. It was not, there wasn't dust anywhere, but it was on the walls. And as homes start deteriorating, the walls start deteriorating, plaster comes down, that dust breaks up and becomes, or the particles break up and become dust. And so I wanted it removed right away. So we went through the abatement process, which was considerably less, but still very expensive. And the contractors that we hired, I thought were very in the know. They said that they, were RRP certified, which is the remodel, renovate, paint certification, and said that they had huge government contracts. And when the contractors showed up and started doing some work, I was a little taken aback because they were pulling some. This was a side project. They were pulling some tile up and some the countertops, and they hadn't put anything out. And I was like, "What's why aren't you being more cautious?" And he said, "Well, as long as your kid isn't eating paint chips, it's fine." Which is, I get the thought, because that's what I had originally thought, but yeah, I was really upset. So I actually went through the process of having their work kind of checked, where I called the testing company, and after they had done the paint, I had the testing company come out and test the house, and they had created a hazard. So, like, they had brought in all this stuff, had a huge, basically, work plan that was supposed to involve HEPA filters, and made us relocate for a month. And then there was lead dust all over the floor. So I was like, you need to come back, clean all this up. And it delayed us moving back into our home. So and it was expensive because it wasn't part of it, and they were like, why are you going back? And I'm just like, I don't trust you, and this is why. So basically, my son's levels went down because we removed him right away. We abated the home, so we went through all of the correct procedures, and he's doing great. He's 2.5 years old and super excited about Santa coming, and won't stop talking about this garbage truck that he wants. So he's happy and healthy. But this is such a community health problem, and a lot of stories don't end up this way. And I'm really lucky that I guess that I had the time and energy to devote to educating myself. And it's inspired me to become an activist. So I'd like to share some of my lessons learned. Let's see, down here. So basically, the biggest lesson learned, obviously, is that you don't have to eat paint chips to be exposed. That the hazards are everywhere, or there could be potential hazards everywhere, from the porcelain enamel on your sinks, to water, to outside ground, to just spices, makeup. I've definitely learned it could be a lot of places. And that the people who are deemed experts are not necessarily, and you have to you have to watch out for that, because there were many antecedents that could have stopped this poisoning from happening. My OB could have asked me if I lived in a house that was built before 1978 and tested me then. My pediatrician could have asked me if my home was built before 1978. And I realize that a lot of people don't know if they're renting, but you need to find out if you're expecting a child, or even just for yourself, because adults can be poisoned too. And the contractors, like they clearly didn't do their job. Every contractor, uh, it's a federal law that they be certified, and they should hand you this packet when you're getting work done. And if you're doing work on a home before 1978, you should definitely look into being certified with RRP, and they should hand you this little um, uh, packet. And then obviously, um, follow through with the things that are in it with HEPA filters and removing and checking for dust afterwards, testing and retesting. And it's not difficult to find out these potential environmental lead hazards, but it's expensive. It's every time we tested, it was between $600 and $1,000. Like the whole home test that we did in our previous home was, yeah, it was 1,000, and then every time it was $600, and it's like you can get the little lead test, and if you have something that's in a suspicion, you can get the little crack and test and find out, but to actually confirm, look for dust, and get a whole house sweep of it, it's very expensive, and the correct abatement is so important, because you could create, in my situation, we created a hazard when there really wasn't one, like an active hazard. It was on the walls and could have been and would eventually, but it created a huge problem. And this goes from like hanging a nail to, doing any kind of work in your home could expose. So you really need to be an advocate and an activist, and you can be an advocate through. There's a wonderful organization that when your child is exposed, they notify the health department. The health department refers you to DLED, which has been awesome. Mary Sue's here today, and she's a wonderful advocate and helps us all. And DLED is the Detroit Lead. What is it? The Detroit Lead. I'm trying to get the acronym. Detroit Lead advocacy parent group that I've been a member of since we found out about all of this. And so it's a group of parents, educators, and community partners who are working to build awareness and create strategies to end lead poisoning for Detroit's children. So we meet every month on the fourth Thursday, and we have various speakers. And so it's not only very educating, like we have, lead in the water, lead in the law, getting children's tested, proper nutrition. This past week, we had a lead and learning disabilities educator come. So it's been really helpful just having the support and education. But also, just having a network of support, because a lot of people don't aren't as aware or educated until you're in it, unfortunately. And then it's helped me become a better advocate, a better activist. So you can basically, you need to know what district you are in. You need to know who your city council is, know who your state representatives are, and lobby for this universal testing bill that's coming up. And this basically calls for testing at ages 9 to 12 months. Again, I think at 3, and then I'm trying to look. And again at 4, and it's for those in high risk areas. And it also has education for the pediatrician. So I think they have to be obviously more educated in lead exposures, lead hazards, and it also adds the lead exposure to a child's immunization record. So I think it's going to be reintroduced in a new session starting in January. So with the Democratic State House and Senate, we'll have a good chance. That's great. And yeah, I just wanted to open it up if anybody had any questions for me. I don't know if
Yeah,
we're
we can take a question or two. I had asked folks to, if they had questions, to put them in the chat also.
okay. I'm looking. Oh
Allison,
yeah,
I
you
do
were
have a
talking.
quick question for you.
Sure.
I was surprised that you already suspected something at 9 months when most people know nothing at all about lead. What was it that got you educated at least even a little bit to know to question it?
He didn't have any, signs or anything other than it was hard for him to go to sleep at night. I was very tired. But I'm just, I guess, it was living in a home that we were renovating that I was suspicious about because I just, just from a little bit of education in psychology and environmental science, I knew it was a problem, but um, yeah, the the biggest problem is that there isn't this great system in the real estate industry to like inform a buyer. Basically, everybody gets off the hook by saying they don't know when they buy and sell a property, or they when they sell a property, and it should really be that it's every home is tested as part of the inspection process. And I wish that would have happened in both instances because you should know, where these things are. And like I said, it's very expensive. But yeah, I honestly, it's just mother's instinct that I even tested him, and I wish I would have sooner. Or I wish I would have tested the house sooner, and the canary in the coal mine wasn't my son's elevated level or his poisoning. It was the house being sick and not him being sick. Thank you.